Today we're talking about the top 10 mistakes that students make in their medical school interviews. I'm Darlene, a resident and a Moon Prep counselor, and with me is Lauren.
Hi, I am also a Moon Prep counselor and a UNC MD PhD student. And last year we've conducted over 100 interview prep sessions with pre-meds. So these are the most common mistakes that we help our students overcome.
So the first one is overemphasizing your accomplishments. It's really important to make sure you stick to your theme and to show purpose in any of your answers.
We don't want to over-relay everything on your resume. Let your accomplishments come out naturally if it relates to the question. You also don't want to be misrepresenting what's on your resume. So it's important to be authentic.
Everyone is looking for a new candidate that brings something new to the table. So let your true personality show and don't try to pretend to be someone that you think they want to see. The next one is not reviewing your ethics questions. There's a really specific way to learn and practice all these ethics questions that you see, and there is a really good formula to use. Ethics is also being seen at more schools, so you definitely don't want to miss this question.
And likewise, ethics questions are seen in both MMI and traditional interviews. So regardless of which type of interview you have coming up, you want to adequately prepare for those ethics questions. Next up, we have being too narrow-minded as a common mistake. So when you're asked an interview question, especially if it's a situational type of question, you want to consider multiple points of view and not just one person's point of view to show that you're being thoughtful in your responses.
So being inclusive is super important for any medical school interview. Diversity, inclusion, and equity is a huge topic that every school will ask you. So that leads us into the next one, talking negatively about other people or other professions. In medical school, one of the most important things that we're taught is professionalism. And if you're talking negatively about other people or other professions in your interviews, then that kind of, speaks for itself of how you're going to work in teams with other people.
Likewise, on your interview day, you want to show respect for everyone. So not just your interviewers, but also anyone that you're interacting with on your interview day, whether that be in person or virtual. Next up, we have using buzzwords incorrectly. So we see this a ton, and especially with one of our buzzwords, underserved. So if you're interviewing at a school that primarily serves underserved patients, you want to know exactly what you're talking about.
Another one that we also see is increasing access to care. Everyone, I think, has the same goal, but what does it actually mean? You actually have to know how the healthcare system works in order to use these buzzwords effectively. So next on the list is not practicing or just winging your interviews because you don't think this interview is as important as some of your top schools. Every interview should be taken seriously, and it's always a good opportunity to practice.
Absolutely. And on the note of practicing, each interview is a practice session for the next. So if you have the opportunity, it's best to schedule your more important schools later on in the interview cycle and the schools you might not care about as much earlier on. Likewise, up next, we have not researching the school. So you must research the school in order to have a good answer to the question, why our school? You want to be specific to you and why you make a good fit at that school.
And that's such a good point because each school has a specific mission. So you want to make sure you know what that mission is and talk about how your personal values and their values also align. So another point is not having a really clear answer when they ask you why med. Remember to read your essays before your interviews to remember some of the themes or the points that you talked about.
You also want to make sure that your answer is clearly answering why you must be a doctor and not something like a PA or a nurse practitioner. And that's something that we help our students craft in their answers. And last but not least, we have avoiding your red flags. So this one is super important. Med schools have already seen those red flags on your application and liked you enough to give you an interview. So make sure that you address them so that they know that you're being self-aware.
And if you're hiding your red flags, it kind of shows them that you haven't really overcome them. So take the opportunity to self-reflect and show them how you have improved on those red flags. If you want to see more med school content, please like and subscribe to our channel.
To learn more about working with us to prepare for your medical school interviews, visit our website at moonprep.com.